Today, we're talking about Temozolomide Solution, Reconstituted, also known as Recon Soln. This medication is used to treat certain types of brain cancer. Temozolomide belongs to a class of drugs known as alkylating agents. It works by slowing or stopping the growth of cancer cells. It is important to take this medication as prescribed by your doctor. The dosage and timing will depend on your specific condition, so make sure to follow your doctor's instructions carefully. If you have any concerns about taking this medication, be sure to discuss them with your healthcare provider. Before starting to use temozolomide, it's essential to read the patient information leaflet from your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. This medication will be given to you by injection into a vein, and it should be done by a healthcare professional, usually over a 90-minute period. The dosage and treatment schedule will depend on your medical condition, height, weight, and response to treatment. It's crucial to carefully follow the dosing schedule as directed by your doctor to get the most benefit from the medication. To help you remember, mark your calendar to keep track of when to receive the next dose. In addition to temozolomide, your doctor may also prescribe other medications, such as antibiotics, to help prevent infection or side effects. Be sure to follow your doctor's directions for taking all your medications. Some common side effects of temozolomide solution may include nausea, vomiting, loss of appetite, mouth sores, changes in taste, constipation, tiredness, dizziness, trouble sleeping, headache, or pain/redness/swelling at the injection site. Your doctor may prescribe medication to help with nausea and vomiting, and eating small meals or limiting activity may also help to reduce these effects. Temporary hair loss may occur, but normal hair growth should return after treatment. It's important to be aware that there are some serious side effects associated with this medication, but your doctor has prescribed it because the benefit to you is greater than the risk of side effects. It may also rarely increase the risk of other cancers and decrease bone marrow function, which can lead to low blood cell counts. If you experience symptoms of liver damage or a serious allergic reaction, it's important to contact your doctor right away. And if you notice any other effects not listed here, be sure to discuss them with your doctor or pharmacist. Before starting treatment with temozolomide solution, make sure to inform your doctor or pharmacist about any allergies you may have, as well as any medical history of kidney or liver problems, bleeding issues, or blood problems. Temozolomide may increase your risk of getting infections or make existing infections worse, so it's important to avoid contact with anyone who has a contagious infection. If you have been exposed to an infection, be sure to consult your doctor for further guidance. It's also important to let your healthcare professional know if you are planning to receive any immunizations or vaccinations while using this medication, and to avoid contact with individuals who have recently received live vaccines. Be cautious with sharp objects and activities that may lead to cuts or injuries while using temozolomide, and avoid alcohol and marijuana, cannabis, as they may increase dizziness caused by the medication. If you are a woman or an older adult, you may experience increased sensitivity to the side effects of this drug, including a higher risk of infection and easy bruising or bleeding. For men, it's important to refrain from donating sperm while using temozolomide and for 3 months after stopping the medication. If you are pregnant or planning to become pregnant, you should not use temozolomide as it may harm an unborn baby. Reliable forms of birth control should be discussed with your doctor during treatment and for 6 months after the last dose. If you or your partner becomes pregnant while using this medication, it's important to speak with your doctor immediately about the potential risks and benefits. Breastfeeding is not recommended while using temozolomide, as it is uncertain whether the drug passes into breast milk. Be sure to consult your doctor before breastfeeding while using this medication and for 1 week after the last dose. When taking temozolomide solution, it's important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of temozolomide solution. If you or someone you know has taken too much temozolomide solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. Before starting temozolomide solution, Reconstituted, Recon Soln, it is important to undergo lab and/or medical tests including complete blood count, liver function, and brain scan. These tests should also be continued while using the medication. It is crucial to keep all medical and lab appointments. Remember, it's crucial to take each dose of temozolomide solution, Reconstituted, Recon Soln, as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately for a new dosing schedule. Never double the dose to make up for a missed one. And always take this medication at the same time each day to maintain a consistent level in your body. You can only receive temozolomide solution, Reconstituted, in a hospital or clinic, and you won't need to store it at home. This medication is used to treat certain types of brain tumors. It works by slowing or stopping the growth of cancer cells. The usual dosage is based on your medical condition, body size, and response to treatment. It is important to take this medication exactly as prescribed by your doctor. This medication is usually given once daily for 42 to 49 days, or as directed by your doctor. It is best to take temozolomide solution, Reconstituted, on an empty stomach, at least 1 hour before or 3 hours after a meal. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.